Hi, everyone. Thanks for joining us today. Today's webinar is called Protecting Migratory and Seasonal Agricultural Workers from Chronic Kidney Disease. We're going to do some basic information about this topic, and I'm hoping we can enrich it a little bit as we go. It looks like there's some folks on the call with really great experience in this area. So we really love to facilitate any peer sharing. This is a webinar style, so we can't come off of mute or come onto video, but you're welcome to use the chat or use the Q&A feature at the bottom of your screen. So my name is Bethany Alcauter. I'm the Director of Research and Public Health Programs, and I'm joined today by my colleague Missy Gallegos. She is the Health Education Coordinator. So, like I said, this is pretty much kind of an intro style webinar on this topic. So, our main objectives today are looking at CKD or chronic kidney disease and understanding why farm workers might be at higher risk for developing the condition, looking at some signs and symptoms of CKD and what types of intervention and support we can implement for farm workers. And we're going to talk about some effective best practices and strategies to help farm workers mitigate the effects of heat stress and protect the health of their kidneys. So we're going to do an overlap. And if you're new to this topic, we'll talk about why these things are connected, heat stress and chronic kidney disease. So let's talk about heat stress a little bit first. If you work with farm workers, you're familiar with this topic, of course, but here are a few key points in case you're newer to the topic. Ag forestry and fishing workers are 35 times more likely to die from heat than workers in other industries. Overall, across industries, men are more likely to die from heat stress at work than women are. And a little bit surprisingly, in terms of just general work-related heat fatalities, age is not a significant risk factor. Younger, healthier individuals can also die from heat stress. And then the research we have based in the US indicates that about a third of heat-related deaths occur during the month of July, and most workers will start feeling sick in the afternoon. So, what is heat stress? This is a good definition to explain to workers. It's just when your body has excess heat, it can't get rid of. So, normally our bodies run at about somewhere between 97 and 99 degrees Fahrenheit. And so, heat stress is happening when our bodies are running above that normal threshold and can't get back down. There's a relationship that seems obvious, but isn't no always obvious to everyone. But there is a tight relationship between heat stress, being dehydrated, and experiencing a heat-related illness. So a lot of times what you'll see is workers, outdoor workers, including farm workers, will start off their day dehydrated. When that happens, they're less able to tolerate the heat. So their body has a harder time dealing with the heat that they encounter throughout the whole day if they're starting off the day dehydrated. Workers who are already acclimatized to the heat will have more sweating. That makes sense, right? Sweating is our body's way of cooling off. And if workers are accustomed to the heat, they'll sweat more. And those workers can become dehydrated more quickly because of the sweating. And of course, dehydration is not just the loss of water, but it can cause electrolyte imbalances. And electrolyte imbalances can also worsen dehydration. So there's a lot of things going on that our bodies are trying to do to compensate for hard work in the heat. And any of those things being off can kind of exacerbate the others. Sorry, my slides move along a little bit slow. We have heat-related illnesses when we're talking about acute heat-related illnesses, so things that happen quickly. There's a range in severity, ranging from a simple heat rash up to heat stroke and a death. when we talk about CKD, we're going to talk more about the chronic implications of heat stress. But most of the time, when we're talking to farm workers, this is the range of illnesses that most people are familiar with. So let's talk a little bit about hydration and electrolytes. And this is totally a trick question. So, which urine sample do you think indicates the worker is severely dehydrated? One, two, or three? We have some answers for number three. Give people a few more seconds. All right, Ryan said all. Yes, Ryan is correct. All of these workers were severely dehydrated based on their urine-specific gravity testing. Um, the brown urine we'll talk about in a minute. So urine color it's not a perfect way to tell how hydrated people are, but it is a good way for workers to monitor their own hydration status. So you can see here if it's very clear, they can potentially be overhydrated. If it's just a little bit yellow to kind of a slightly darker yellow, that often indicates they're normally hydrated. If you start seeing dark yellow or brown, that can be a big issue. There's other things that can come up. Obviously, if there's blood in the urine, that can make it look pink. And there's other diseases that can cause different color urine outside of this yellow to brown range. The brown urine, so those urine samples were from a small heat stress study done in Texas with construction workers. Brown urine can happen from different causes, but when we're looking at outdoor work with kind of an intense workload in a high heat situation, what we get worried about is a condition called rhabdomyolysis, and that occurs when your muscles are breaking down and releasing proteins into your bloodstream. Rhabdomyolysis can happen in situations like car accidents or injuries, but it can also happen if there's extreme exertion going on and they're dehydrated and experiencing heat stress. So I'm going to go back for just a moment so you can see the urine color. So this dark brown, it can get even darker. It can look like Coke or black tea. I wasn't able to confirm if this worker was experiencing rhabdo at the time, but he was experiencing a lot of symptoms of heat stroke. Another issue that can come up is acute kidney injury. And this is being documented in many places in many different research investigations where workers, because they're under so much exertion and they're dehydrated, they experience an acute kidney injury. If that happens repeatedly, over time, that can develop into chronic kidney disease. So there's some good tips we can give workers. What I've found in talking to workers, landscapers, construction workers, farm workers, is a lot of people don't understand how much water they need to be drinking. And obviously, it's going to vary a lot based on the person, their body weight, how much they drank the day before, etc. But there are some good guidelines we can give workers. So a guideline I like to tell workers is that if it is hot outside and if they are sweating throughout the day, around a liter an hour, so two plastic water bottles, is kind of a good rule of thumb. Workers don't need to force themselves necessarily to drink that amount of water, but this is just some general guidelines that we can give workers. We can get a lot more precise about it, but on the fly, I think with training, general trainings for workers, that's a good guideline. The other thing we can encourage workers to do is they want to think about their electrolytes as well. So workers are sweating throughout the day. If it's 85, 95 degrees outside, they might be sweating a lot and losing a lot of salt and a lot of electrolytes. So one thing that workers can do is water down their Gatorade. Gatorade has a lot of sugar, and isn't necessarily that helpful to drink it straight. But if they water it down, 1 part Gatorade, 2 parts water, that's helpful. They can also make a homemade Gatorade or suero, as a lot of Latin American workers refer to it. And that is for every liter of water, you add a tablespoon of sugar and a quarter to 1/2 teaspoon salt. And that can help them with their electrolytes. There's other resources too. A lot of the foods that people like to eat when it's hot outside can help them replace electrolytes, and we have a flyer that documents some of those foods. So things like watermelon or watermelon with tahini is a great electrolyte supplement for workers, and a lot of people like to eat it anyways. So again, with the salt, I know we've always had a lot of nurses and healthcare practitioners in our audience that are really accustomed to telling workers to consume less salt. But I think the context of where you're working and who you're working with is really important. Some workers might need to reduce salt intake, and some workers might actually need to consume more salt. So, an example of kind of a group of workers that you might want to give special consideration to are workers that you know they do very intense types of work, like strawberry harvesting, milk parlors, pretty intense. So, if they're moving constantly and they aren't getting a lot of breaks to eat and replace the salt they're losing, those are workers that might need more salt intake than we're used to on the healthcare side. Of course, a lot of workers also have comorbidities like hypertension or diabetes or other things that can affect this. So it's best if depending on what type of work you do, collaborating with healthcare staff like doctors and nurses and nutritionists to kind of identify the best advice, especially for workers that have other chronic diseases in terms of their water and electrolyte intake would be ideal. Yeah, there's a comment in the chat that high levels of vitamin B can affect urine color. Another thing I've seen is workers taking dandelion tea for liver issues. That can change the color of their urine as well. Um, so things can happen, but in general, urine color going from pale yellow to dark yellow, it will just help workers monitor their own hydration. Yeah, so here's a list of some of the other foods we mentioned that are good sources of electrolytes for workers. So besides just suero, bananas, watermelon, avocado, yogurt, queso fresco, bone broth in caldos and things like that are all great sources of electrolytes. All right, let's talk about chronic kidney disease a little bit. Um, So, chronic kidney disease can have many traditional causes that are well known and well established in science and healthcare. Those main traditional causes are diabetes and high blood pressure. However, what we're here talking about today is chronic kidney disease of non-traditional causes. And this type of CKD is found in people that do high intensity agriculture or other very physically demanding occupations, like certain jobs in construction. And that type of CKD is mostly related to workload and heat and people's core body temperature. Of course, they could coexist, right? People can have hypertension and it can become a chicken or the egg problem where we're not sure if the hypertension caused the chronic kidney disease or if the chronic kidney disease is causing the hypertension, especially if you have workers who don't get a lot of primary health care. Um, so it's a little tricky, especially I think here in the US where we have a lot of these chronic diseases in our general population. CKD of non-traditional causes is a leading cause of death among men in some Central American countries, and it's been found in other places outside of Central America as well. We have really strong evidence that it's linked to that physically demanding work with not a lot of rest or rehydration. And, it's not something that happens in a week. It's something that happens after months or years of exposure. And it can lead to the different phases of stages of chronic kidney disease that we'll talk about in a moment. I wanted to make an aside here about workload for farm workers. I think that we need more research documenting how intensely farm workers work in different jobs here in the US, but we do have some research about it. Um, there was a really interesting study with corn detasselers in the Midwest, and they found that they were burning between 350 and 540 calories an hour. So between 2,800 and over 5,000 calories per day, just depending on the person and the task. So, if someone is burning on the low end of that, if they're burning 3,000 calories a day and they need 2,000 just to for normal body maintenance, then they need to consume around 5,000 calories a day. And this amount of calorie burn is really similar to sports players. So I like to share these points because it really catches employers' attention, it catches workers' attention that they are functioning as athletes in the course of a normal workday. CKD, whether it's traditional causes or non-traditional, it has 5 stages. It's basically silent, until you get into the more severe stages. Although people in the audience, you can correct me if you've seen differently. But a lot of times in stage 1 and 2, your kidneys are still functioning pretty well, and the person won't have any signs or symptoms of it. In stage 3, they might have some signs and symptoms that can show up, but a lot of times it's not until the more severe stages in stage 4 and 5 that people will notice. Um, in CKD, the progression of the stages is measured by basically how well the kidneys are doing their job, filtering the blood, and that's called the estimated glomerular filtration rate of the kidneys, or the eGFR. My slides are stuck again. There we go. All right. So if there are signs in any earlier stages of kidney disease, it might look like fatigue or feeling weak. Obviously, this is really hard in farm workers because they're tired all the time, especially during busy season. You might see some changes in urine. It could be a change in color or quantity or frequency of urination. They could see some swelling, but generally that happens later. In the later stages, in stages 4 and 5, you have very noticeable signs and symptoms. So people can feel really sick. They can have nausea and vomiting. They'll have a lot of swelling in their extremities or in their face. Cramps are common, dry and itchy skin. They often don't have a very good appetite because of that nausea. The fatigue gets extreme, so it's not just general fatigue, it's a much more intense fatigue, and you will notice changes to urination at that stage. People who are in stage 5 that are on dialysis generally stop urinating completely once they're on dialysis. For screening, and I'd love to hear what folks are doing in the chat. If folks are doing screening for chronic kidney disease among farm workers, that would be really wonderful to hear about. I know about it in research protocols, but in terms of general practice, I'm not sure how often that's happening. There aren't any medical protocols in the US specific to screening high-risk workers for CKD of non-traditional causes. So it will happen, of course, if people have diabetes or if they've had hypertension for a while. But in terms of just the high risk workplace scenario, there's nothing national happening in terms of protocols or recommendations for that. If you are a clinician, or if you know clinicians who work in high intensity agriculture, which is really most planting and harvesting activities, especially if it's by hand, milking cows and pushing cows can be very intense. Poultry depopulation can be intense. And if they're doing all of that, especially in a region of the US where it's really hot or really humid, you may want to implement some regular EGFR screenings for those workers. Testing for CKD is usually a blood test and a urine test, and that enables the clinician to check the filtration rate and to look for any protein in the urine, which would indicate kidney issues. I'm curious too how many of you, this isn't necessarily a part of CKD, but I have met many outdoor workers who have kidney stones really frequently, and they have a hard time preventing them. I'm not sure if other folks have seen that. So I think heat stress issues, including chronic kidney disease that's tied to heat stress, is both exciting and frustrating because the prevention is so easy. It's so easy in theory, right? But sometimes it's really hard to get these workplace interventions put in place. So all of us know that water, rest, and shade is a big deal for workers in preventing heat-related illnesses or long-term effects of experiencing heat stress. And the thing that I've seen often as an issue on US farms is there's water and there's shade, and in theory there's rest, but those things may not be accessible, right? So if the shade is half a mile away, or if the water is half a mile away from where workers are working, it can be hard to access it. If there's a stigma against drinking water or taking a break to drink water, that can make it inaccessible. And then, of course, if they're working piece rate, that is a major disincentive to resting or drinking water regularly because they're losing wages. So a lot of our job, I think, as organizations that work with farm workers and work with producers, is to make sure there's not just water, rest, and shade, but that all of those things are accessible, kind of physically and mentally. So making sure that those things are easy to access is really critical. And if it does go above a certain temperature, which can vary by state, or kind of by different states have different regulations on this, but mandatory rest breaks once it gets hot, over 80 or 85 degrees are a really good idea. We'll talk about a buddy system. This is important for more acute heat-related illnesses. And we also highly recommend that all levels of human resources are trained on preventing and recognizing and responding to heat stress and heat-related illnesses, including office staff, including crew leaders and foremen and mayordomos and workers themselves. We see a big difference when everybody understands the importance of those preventative actions and what can happen if they're not in place. A buddy system is so critical, I think, especially for those acute heat-related fatalities. And there's a lot of good examples of how farms have implemented this, but this is when all workers are paired up and they're responsible for checking on each other. We've often seen that there can be a lot of confusion among workers because sometimes alcohol use comes up as an issue for workers. And if people are experiencing heat stroke, sometimes it can seem like they might be drunk or intoxicated. And so having that buddy system where people know each other one-on-one and understand each other's normal behavior, that can really help people act quickly if someone is experiencing a heat-related illness and starts acting different than they normally would. It also helps them feel more comfortable telling each other when they feel sick, and they can act as an advocate for the other person. A good I think, a really good implementation of the buddy system that I've seen some farms use, especially if people claim a row, like a row of tomatoes or a corn row. If workers, where they can't see each other because the plants are so big, then as workers move down the rows, they'll put a row marker at the end of the row so that people, their buddy or the crew leader or whoever knows where each worker is at. There's a ton of research on productivity and water and rest, and our friends at La Isla Network we're hoping to get them to present soon. They've done a lot of work in this area and have really compelling data to share with producers on all that work that they've been doing over the last 10 or 15 years. Um, there is a really simple study that was done a while ago that I like to share with producers because it's so easy to understand and it's so easy to see the benefits. This was a study done in Nicaragua with sugarcane workers, and those workers were given camelbacks. They set up shade tents. They had really frequent rest breaks. They were resting for about 25% of the workday, and they got some better machetes. So the workers were harvesting all of the sugar by hand, and they got improved machetes. And after these interventions, the workers felt better. Their heat stress and heat-related illness symptoms went down. Their water intake increased, and their productivity increased. They went from harvesting 5 tons to 7 tons after the intervention. So again, going back, all of these things, I think it really helps if we can help everyone else, workers, crew leaders, and producers, to help them understand that workers are functioning as athletes. And we don't expect soccer players or basketball players to play a game for 2 or 3 or 4 hours with no water breaks and no electrolytes. We know that they won't function at their peak if they're under those kinds of stressful conditions. So making that parallel, I think, is really helpful in getting people to take action because this is a very male-dominated field. A lot of men relate to sports and connect with it, and so sharing that example is so important, I think, in getting people to change behavior, especially with producers who are often very focused on the productivity and might have, legitimate concerns about increasing rest breaks and that having a negative impact on how much food is harvested or just on work getting done in general. But overall, time and again, we see that if people can have all the necessary um, you know, implements to function at their peak and to take care of their bodies, that they'll function better as workers. And they'll go home and feel better, which is really important. So some things we can do as outreach staff and people that work with farm workers is, offering to help farms develop a heat emergency plan or just basic protocols when it gets hot out in terms of rest breaks and shade tents and things like that. Um, Working with them, if you have that kind of relationship with the farm, to check out how their setup is. Is the water accessible? Is the shade accessible, etc. And helping them make suggestions on how to improve that can be a wonderful thing to do. And then motivating workers as well, and giving them some of their agency and emphasizing that they can take care of their bodies, and by doing that, they'll take care of their families if they are able to monitor their own health and take action when they need to. All right, I'm going to pass it over to Missy to talk a little bit about a resource that she worked on.
Yes, thank you, Bethany. Such great information. You always do such a great job. Like, even though we work together, I still love listening to your webinars. But with everything that we've been talking about or what Bethany has shared with you all today, in reference to outreach, as far as, tackling some of the outreach that Bethany shared that you all can do, on that last slide. But a part of that is also sharing self-help resources, patient tools that you can bring with you while conducting outreach. And so we are currently in the design phase of developing a new patient tool that is for outdoor workers, like migratory and seasonal agricultural workers, that's going to educate them on how they can protect their kidneys while working in the heat. This resource tool is not only going to address, the importance of drinking water, but how dehydration impacts them, and if they're constantly being dehydrated, how that's going to potentially create that permanent damage to their kidneys, and just again the importance of staying hydrated. We when we create our resources, we do like to run them by a farm worker committee. We ensure that our resources are going to be relevant, they're going to be relatable to the community that we're serving. So you're going to see drinks in there, and some of the drinks and foods that Bethany had talked about, just again, trying to make it relatable, but like agua frescas, coconut water, and just, of course, drinking water to stay hydrated. The resource will share how much to drink in the morning, how much to drink during the day, and in night at nighttime. So it's this nice little table that's broken down. It's easy to understand. A simple read for agricultural workers. And so, if you go to the next slide, Bethany, you can actually skip over to, because I kind of touched on those already, but you can go over to the next slide. So as Bethany mentioned, signs and symptoms, really outdoor workers, they're a lot of times you're not going to see these until, chronic kidney disease gets much worse. But we did include some symptoms in the resource that outdoor workers can keep an eye out for. A lot of these symptoms did come from the National Kidney Foundation. So I do want to share that because the National Kidney Foundation is here. And so I just want to say thank you for your resource. And I did use that to help develop this tool, and just, really kind of addressing some of those symptoms for outdoor workers and what to look for. And then again, the importance of getting screened, going and visiting a healthcare center or talking to their doctor if they do experience any of these symptoms. And if they when they do go to the doctor, to share that they are outdoor workers, that they're working outdoors in the heat for long periods of time, and that they're experiencing these symptoms. But again, as Bethany mentioned, some of these symptoms she addressed earlier at the different stages of chronic kidney disease and when we may see them, but these will be listed in that patient tool for you all. And as soon as that tool is ready, we will be emailing that to everyone that registered. So we have your email, and you'll get that resource as soon as it's ready, and it will be available in English and in Spanish. Next slide, please, Bethany. You can actually skip to the next slide. Sorry. We have some filler slides in there, but so the slide before this NIOSH slide, we do have some heat related resources that we have on our website that you can find. They're actually listed under our occupational health and safety resources. And so you're going to find a staying hydrated in the heat. When should I drink more water? And so the when should I drink more water is a great resource tool. It's a flyer. It has the urine color chart, and it will indicate when a worker should drink more water. So that's really a great resource that can be used. Vanessa is going to drop the link to our website, specifically to our occupational health and safety resource webpage, directly into the chat. So you will have access to that. I am going to ask for a little bit of forgiveness because we just launched this new webpage. So there are some links that are a little bit that we're trying to fix, but for the most part, all of the resources are there. These are ready to go for you to use for your outreach. So please take advantage of those. And then you can proceed to the next slide, Bethany. So we want to share the NIOSH resource as well. It's a heat guidance. It's pretty much the guide that's titled Criteria for a Recommended standard occupational exposure to heat and hot environments. This is a great guide to provide individuals just those prevention strategies to protect outdoor workers from serious heat health risks from working outdoors and doing strenuous activities, and just really protecting them from those heat related illnesses or injuries. The guide also, it was based on what I was reading, it looks like it came out in 1986, but it's had some updates. And I know Bethany mentioned alcohol and really more in reference to that buddy system, but NIOSH did include these recent findings and studies that include insights on that physiological response to heat. So there's risk factors like age, obesity, drug use, and the effects of caffeine, and how those all play that physiological response can play an impact to heat. And just great information here for employers to implement heat and safety trainings and just helping keep workers safe. And and then Vanessa did drop the link to the guide directly in the chat as well. Next slide, please. So we do want to spotlight La Isla Network. Jason Glasser, CEO, provided some slides for us and some content, and we just really wanted to share some of the great work that they've been doing. I know that some of the staff from La Isla Network is here, so thank you for joining us. And when we get to the Q&A, I would love for you to share a bit more about your Adelante initiative with everyone that's here today. But I am going to give just a brief little insight into this initiative. So this is a collaborative initiative with La Isla Network called the Adelante Initiative. And La Isla Network is a research and advisory organization working worldwide to address heat stress and other environmental exposures. And so within their Adelante initiative, this Adelante initiative was founded in 2017. It was basically to improve working conditions for sugarcane workers facing extreme heat and its consequences. And so this included heat stroke and impaired kidney function. And so through this Adelante initiative, they developed a heat stress prevention plan that included these mandated breaks, these scheduled breaks throughout the day across the entire year, mobile tents that were not just, set up, at a distance, but actually accessible to them. And then, again, stressing on the importance of hydration, having access to purified water, and hydration beverages. And again, lastly, the importance of good hygiene. So those sanitation facilities in the field. And so I do want to read this some data verbatim. So with their efforts through this Adelante initiative, within the first 3 years, they saw a reduced harm with a sharp decline of 94% in cases of acute kidney injury arising from excessive heat, and eliminated fatal incidences of heat stroke, increased productivity by 10 to 20%, and provided a 22% positive return on investment as accidents, staff turnover, and absenteeism was reduced. So great work through the Adelante initiative, and really just wanted to share that with you all today. And Bethany, you can go ahead and proceed to the next slide. And then if you want to click one more time, we can show that last set of data there. It just will pop up there. So this is just, again, data contributed by La Isla Network. And so you'll see that if in the first set of data, there was no workplace improvement set in place, and there was a 21% incident kidney injury percentage. And then in the second set, you'll see where there was prevention strategy set in place, there was a 1% incident kidney injury. And then the last set of data just shows the percentage of time working over 38 degrees Celsius, which is 104 degrees Fahrenheit. But again, just what the great, a lot of what Bethany was sharing, just that those prevention strategies, the prevention strategies that are shared in the NIOSH guide, and then again, through the work that La Isla Network and their collaborative partners through this Adelante initiative has provided. and the great work that it's shown to impact and be able to help save lives for outdoor workers. Next slide, please. And so, thank you again for just being here, listening to the information. Um, Again, our the speakers was Bethany and myself. We do have our emails here in case you would like to contact us for any additional information. I know Vanessa's going to work to get the PowerPoint slide and all that great stuff to you on the recording later, so you'll have access to that later on. Um, and so we are going to move into a Q&A. We're also going to do the evaluation, but if you can proceed to the next slide, Bethany. As of now, this does conclude the webinar portion of this webinar. And so thank you again for just your listening ears and for your time.